Hello. My name is Robert Baptist. I've been in the industry for going on 2 decades now. I've helped thousands of clients, and one of the biggest issues we run into is just understanding how Medicare works. And that's what I want to get into today. There are some things about Medicare you just need to know. Medicare is a federal program. It's been around since the 60s. It is meant to help offset your cost of healthcare. Who's eligible for Medicare? If you're disabled and been disabled for 24 months, you're going to qualify for Medicare. If you have gotten diagnosed with certain chronic conditions, you're going to also qualify almost immediately for Medicare. For the mass majority of us, the person who's going to qualify for Medicare is at 65. You've worked 10 years, taxes were taken out, you're a U.S. citizen. At 65, you qualify for Medicare. A lot of people get 62 and 65 mixed up because Social Security is happening about the same time. But those are two different things. Medicare takes place at age 65. There's some basic terminology I'm sure you've already heard: Part A, Part B, Part C, Part D. Let's quickly go over these different parts so you can understand section of it. Medicare has different rules, and the different rules are grouped into different parts. Part A only covers you if you go into the hospital. So all the rules under Part A, the deductibles, how stays in the hospital, is all falling under Part A. If you're in the hospital, Part A are the only rules that you have to deal with. Now, Part A, of course, turn 65, you can get a Part A. If you work 40 quarters, there's no cost to it. It is 100% prepaid for based on your work history. In most cases, as soon as you turn 65, sign up for Part A. It doesn't cost anything. You're good to go. Next important part is Part B. Part B covers you outside of the hospital. That's going to be your doctor visits, your specialist visits, ambulance rides, lab work. Anything done outside of the hospital falls under Part B. A lot of people sign up with Part A only if they're continuing to work past 65. They get Part A, continue on the work plan. That's perfectly fine. Hospitalization only. Part B, if you're going to go away from your work plan, stop working, retirement, it has to also be in place in order for you to add anything to your coverage. Part A and Part B doesn't cover everything. It doesn't cover dental. It doesn't cover vision. It doesn't even cover prescription drugs, which is what Part D is. Part D is prescription drugs. I know I skipped past Part C. We'll come back around to that. But Part D is strictly D is equal to drugs. That's all it is. Part D is going to cover you if you need pharmacy, medications, help offset some of the cost of medication. All that falls under Part D. If you have Part A and Part B, or if you have Part A only and no other group coverage, it could also lead you into what they call a late enrollment penalty. And you want to avoid that by getting Part D as soon as you can. Part C covers all Medicare Advantage plans. Some people are under the impression that Medicare Advantage plans are not governed by Medicare, and they are. Medicare Advantage plans are simply private insurance that has a contract with Medicare to take care of clients. It's your choice to choose a Medicare Advantage plan if you think it's best for you. I have hundreds of people on Medicare Advantage plans. I have 100 people on Medicare Supplement plan. But Medicare Supplement plans do not fall under the A, B, C, D category. We'll talk about that in a second. But Medicare Advantage plans fall under Part C. They are totally controlled by Medicare. They have to provide you everything that Medicare provides. And then that's where you get into some of the extras: your dental, your vision, your hearing benefits, your gym memberships attached to Part C. Part C equals Medicare Advantage programs. The last thing I want to talk about is Medicare Supplements. Medicare Supplements are also governed by Medicare. They are a private insurance company, but they only cover the remaining balances of Medicare. So where Medicare Supplements falls in a little bit differently is that you have Part A and B. There's rules applied. We can talk about those on a different video. And there's leftover. Most people know there's 20% leftover from Part B or doctor visits. A Medicare Supplement plan can offset all remaining cost of Medicare itself. That's why they call Medicare Supplements. But they don't add extra benefits: dental, vision, and hearing, and all that stuff. They're only meant to follow suit behind Medicare. That's what a supplement is going to do for you. So don't interchange Medicare Supplement with Medicare Advantage because they're just not interchangeable. At 65, you're going to have some election periods. Your initial election period is actually 3 months before your birthday month, and 3 months after. That's what they call your general initial enrollment period. And during this time, you can take your time and select a plan. I do suggest that you start early, but during this time, you can start selecting the plan that you want to go forward. Also, remember, plans are designed to go from 1 year to the next. So these are typically not lifelong decisions. They're just from 1 year to the next. At the end of each year, you can make a decision to change to a different plan. If you found this video helpful, there's another one I think you'll like as well. There's 5 mistakes that typically people make when going into Medicare. There is a video there, but there's also a link here in the description box that will give you tips on how to avoid those 5 mistakes. So just click on the link and get that document. Also, if you want to talk to me personally, there's also in the description box, you can book a little quick 15-minute call and let's have a quick conversation about your individual situation to see if we can help guide you along the way. Of course, there's never a cost for our services. I would love to chat with you. Last but not least, if you like these videos, just hit the like button in the corner. Of course, it'll help us out and know which more content or what type of content to put out.